AANHPI communities all around the nation. They've seen firsthand the suffering and heartache while working directly with patients. They have been educating our communities and advocating on our behalf. And they've seen and have been working closely with local governments and even presenting to Congress on key issues affecting our community, such as the topic around health equity. Today, you'll also be hearing from a range of health experts, starting with our very special guests from the U.S. Department of Health and Human Services, Vice Admiral and Surgeon General Dr. Vivek Murthy, and Lieutenant Dr. Adelaida Rosario, as well as our AANH and PI doctors and researchers from all across the country: Arkansas, California, Hawaii, New York, Texas, and my home state of Washington. And of course, we welcome our partners and friends from the Pacific Islander Council and Team FMG. Doctors, partners, and friends, it is our shared excitement to come together for this national press briefing. We are so proud to have such a strong representation from our communities, especially from our ethnic media. Nearly 180 RSVPs, I believe, in attendance. So we're grateful for your interest, your passion and commitment to amplifying AANH and PI stories, especially in the spirit of further educating among our families and friends about the vaccines. And thank you to HHS for recognizing the importance of speaking to and reaching out to all of our diverse communities in the language and culture of our community's preference. Lastly, I want to express how our journey through a long year of sacrificing important activities in our lives and abiding by prevention measures has truly been a humbling experience. We've had many honest conversations about what the best way forward should be, and I've learned a tremendous amount from our community partners, many of you who are on this call today. But perhaps most importantly, the We Can Do This campaign has brought this opportunity for all of us to come together, to work alongside each other in our collective effort to literally save lives. We've made new friends along the way and look forward to making many more as we partner together with all of you on this important effort. Thank you, and we can do this.
Thank you so much, Tim. Thank you so much, Tim. I wanted to share that we are recording the event for all media partners who are unable to join the event today, and we will be sharing those recordings of our speakers after this meeting. Now I'm honored to introduce our next speaker and special guest from the U.S. Department of Health and Human Services, the Surgeon General of the United States, Vice Admiral Vivek Murthy. As the nation's doctor, Dr. Murthy is in charge of the health and well-being of every American. And as the Vice Admiral of the U.S. Public Health Service Commission Corps, Dr. Murthy commands a uniformed service of 6,000 dedicated public health officers, serving the most underserved and vulnerable populations domestically and abroad. Now I'll welcome Dr. Murthy.
Well, thank you so much, Stella. I really appreciate that kind introduction. And good afternoon to everyone who's joining us today. It's so nice to be with all of you. I'm particularly grateful because, having the Asian American, Native Hawaiian and Pacific Islander community involved in this vaccination effort, having them equipped and empowered to share information, to get people vaccinated is so important, because we don't get through this pandemic as a country unless all communities are vaccinated, protected, and safe. This is really an all-in effort for America. And what COVID has taught us, perhaps more so than any recent experience we've had, is that we really do rise and fall as one nation. We've got to be there to support one another, to get our communities vaccinated, and to ensure that we are protected from future potential pandemics that may come our way. But I want to start actually just by taking a moment to reflect on what we've been through this past year, because it's been unimaginable and profound. And while this pandemic has affected each of us differently, we've all been affected deeply in some way. Some of us have lost family members. Some of us have gotten sick ourselves with COVID. And many of us have watched our lives turned upside down as we've seen our kids pulled out of school. We've seen friends lose their jobs, and we've seen so much in society grind to a halt. During the height of the pandemic, I remember my sister and my father, and my father's in his 70s, they were still seeing patients in their medical clinic in Miami, Florida. And each time they left the house to go take care of their patients, it felt like a small part of my own heart marched out with them because I was worried about them. I was always worrying that this was the day that they were going to be exposed to the virus and get sick themselves. And that's why I'll always remember the day that my sister and my dad became eligible for the vaccine by virtue of being healthcare workers. I drove them to the little vaccination building on the side of Baptist Hospital in Miami, where they see their patients. And as they lined up to get vaccinated, I was standing just outside the building and watching them go in and just thinking about the long road that they and all of us had traveled to get to that hopeful moment. And I really felt overcome by just the gravity of that moment, because it struck me that just a few milliliters of fluid in that vaccine syringe that they were about to get in their arms, that represented so much. It represented the work of thousands of scientists around the world, the willpower of industry and government to work at an unprecedented pace, and most of all, the promise of protection and healing for the people that we love. Not long after my dad and sister got vaccinated, my grandmother, who's nearly 90, became eligible for the vaccine as well. And I took her to get her shot too, along with my mother. And I still remember standing in line, guiding her wheelchair forward as we waited in that long, winding line outside the same building where my dad and sister got vaccinated. And I couldn't help but thinking about everything she had gone through up until that point. She grew up in India under British colonial rule and saw the birth of the world's largest democracy. She lived through the death of her husband and the death of her daughter. She suffered a ruptured cerebral aneurysm and was rushed to the hospital with only the slightest hint of life remaining, but somehow she still made it. She moved halfway around the world from the only home she'd ever known to resettle in the United States and to live with our family. And now with the COVID shot in her arm, my grandmother, who was a survivor to the core, she had made it once again. And that is the power of vaccination. It protects us and our loved ones. It makes us more resilient. It frees us to return to the lives that we love. Today, there are millions of Americans around the country who are breathing a little easier when they or their loved ones leave the house because they've been able to get vaccinated. We have 140 million Americans who have been fully vaccinated and millions more who have gotten at least one shot of the vaccine. Deaths from COVID-19 have plummeted. They're at their lowest point since March 2020. And the vaccines that are authorized here in the United States, and we have 3, are proven to be effective against the COVID variants that are circulating in our country. This is extraordinary news. If you had asked me a year ago if we would have not one, but multiple vaccines, and we would see such a dramatic reduction in cases and deaths, I would have said, wow, that's going to be ambitious, but yet here we are. But while we see this incredible progress, we are definitely not out of the woods yet, because over the last year, we have seen this virus slip out of our control. We've seen it dupe us and resurge in various parts of the country. So in order for cases to not only come down, but to stay down, we need to get more people in our communities vaccinated. And that's why we've got to focus on 3 key areas: information, mobilization, and access. First, we need to make sure that on the information front, that people have solid scientific evidence and information from people that they know and trust. And that's why the doctors that you are all going to be talking to today are so important in this process, because we see in study after study that large majorities of people say they want to talk to their healthcare provider about the vaccine if they're trying to make a decision. Trusted messengers really matter. But in terms of mobilization, we've also got to convey how important it is to get vaccinated. Some people are seeing declining case numbers and thinking, hey, this is over. I don't have to worry about COVID anymore. Others might be young and at lower risk and are thinking, gosh, I'm not really going to get sick, or if I do, it won't be a big deal, so I don't need to get vaccinated. Both cases are absolutely, it's absolutely essential that people still get vaccinated, because we know this is not over, but we also know that young, healthy people, even if they're at lower risk than older people for bad outcomes, they can still have difficulty. Thousands of young people have been hospitalized with this virus. Many, unfortunately, have died, even though it's a small minority. And we also know that young people can transmit the virus to others who are more vulnerable. But finally, in terms of access, we need to knock down every single barrier we can to people getting vaccinated. And that means providing things like paid time off from work, childcare, rides to vaccination clinics, extended hours at pharmacies, and any help that we can muster, including incentives to ensure that people have everything they need to get vaccinated. Now, I'll say, though, that the first area, information, that I mentioned is one that's of particular concern to me right now, because we see a lot of uncertainty around the vaccine among those who are unvaccinated that's linked to misinformation. In fact, when people have looked at those who are not vaccinated yet, it turns out that 2/3 of the people in that category either believe common myths about COVID or they think that those myths might be true. And these myths include the false belief that you can get COVID from the vaccine. That is not true. Or the notion that the vaccines cause infertility or DNA mutations. Neither of those are true either. And yet consistently, despite the fact that these have been debunked and proven to be false, we still hear from clinicians and faith leaders and other partners who tell us that they have people in their communities who are quoting this misinformation and who are relying on that misinformation as a reason not to get vaccinated. The truth is this: these vaccines have been studied rigorously. They've been developed carefully. The data on these vaccines has been evaluated by government scientists and independent scientists using the highest standards. And we now have more than 300 million doses of the vaccine that has been administered in the United States alone. That constitutes a tremendous amount of experience with the vaccine. And what we've seen is two things from all this experience. One, the vaccines remain remarkably effective in preventing COVID. And two, they also retain a very strong safety profile. So this is really good news. But what we've got to do is make sure that people know this information. And so at the end of the day, the vaccines are our best tool to end this pandemic for good. It's our best pathway to returning to the lives that we love, to watching our kids participate in sports tournaments and go to slumber parties with their friends and celebrate birthdays around big tables in restaurants, or to go on vacations with their families. These are so many of the things that we have missed, but we have an opportunity to get them back. But in order to do this, we're going to need your help, because all of us have to step up to do our part in this moment, to help dispel this information, to help mobilize people, to help make the vaccine more accessible to them. And there are two ways that I'd like you, all of you who are listening today, to help join us in these efforts. So first is to make sure you're providing clear, consistent information that's rooted in science, that meets people where they are. And doing that through the articles you write, through the other media products that you develop, doing so in multiple languages so people can access this information if they don't speak English. You can also remind people that they can feel confident getting vaccinated, but it's also easy to do so. Right now, anyone can go to vaccines.gov, type in their zip code, and find places close to them to get vaccinated. They can also text their zip code to 438829, which spells Get Vax, and they'll also receive places close to them where they can get vaccinated. There are more ways than ever to get vaccinated. It's easier than ever, but we still need to make sure we connect people to those opportunities. Second thing I want to ask you to do is to lift up the voices of trusted messengers in your communities, whether they're doctors like the ones on this call, nurses, faith leaders, or other community leaders. Many people may not be convinced by a new study that they read about in the paper or a traditional authority figure, but they may be moved to act by somebody they already know and trust. It could be their doctor, it could be a family member. So as you lift up these voices of trusted messengers, I also want to highlight our COVID-19 Community Corps and our nationwide month of action, both of which are all hands on deck efforts to mobilize trusted members to get their communities vaccinated. We launched our Community Corps not that long ago, just a little over a month ago, and we already have thousands and thousands of organizations and individuals around the country who have joined. We do periodic calls for the Community Corps. We give them updates, provide them with tools to help inform their friends and their communities. But it's really a community that also helps teach each other and share best practices with one another. Before I end, I just want to thank all of you again for the work that you've been doing to empower and advocate for our Asian American, Native Hawaiian, and Pacific Islander communities. I know you've worked tirelessly to provide up-to-date, accurate information about COVID and its consequences. And you've done so at a time when people of Asian American descent have faced a wave of hatred and threats of violence. You know, as somebody who's Asian American myself, whose wife is Chinese American, and whose kids look like exactly the beautiful blend that we once dreamed of, my wife and I, of Indian and Chinese kids, I worry about my children. I worry about my wife. I worry about people who may look at them and unfairly blame them in some way for this terrible pandemic. Our Asian American, Native Hawaiian, and Pacific Islander community has borne the brunt of too many threats and attacks during this past year. But you can help set the record straight on that. You can help call out those acts of violence. You can help remind people that they have a community in this country that knows that they belong, that recognizes that they are a part of this country, just like anyone else. So I know you'll be talking with more doctors in your breakout sessions today, and I hope you'll feel free to ask them as many questions as you'd like about COVID and about the vaccines, because getting that information out to communities is absolutely essential. So thank you all again so much for your partnership. I want to thank Stella and her wonderful team for helping organize today. And I'm eager for you to meet and speak with many of the doctors who have joined us on this call today. Thanks again so much. And Stella, I'll turn it back over to you.
Thank you so much, Dr. Murthy. Our next speaker is with the Office of the Surgeon General, Lieutenant Adelaida Rosario. Dr. Rosario studies the connections between behavior and social and cultural determinants and how these factors affect health disparities for different minority communities. She has worked with Hispanic and Pacific Islander populations to study how these factors relate to early childhood development, mental health, risk behaviors, HIV/AIDS prevention, and substance abuse. Dr. Rosario is involved in numerous efforts and collaborations to increase diversity in the biomedical and federal workforce. Welcome, Dr. Rosario.
Thank you so much, Stella, and thank you all for being with us this afternoon. Hafade, buenas tardes y días todos. Oru estei parabai gaigiguini. So hello and good afternoon and morning to all. I am honored to be here with you today, and I honor my ancestors for allowing me to work for the betterment of my community. I am Dr. Addie Rosario. I am Chamorro, originally from the village of Dedidu on the U.S. territory island Guam, where much of my maternal family still resides today. So we know that some racial and ethnic minority groups continue to be disproportionately impacted by COVID-19. They're at increased risk of getting sick, having more severe illness, and dying from COVID-19. We also know that longstanding health and social inequities, such as discrimination, occupation, poverty, housing, healthcare access, all cause certain racial and ethnic minority groups to be equally unaffected by unintended economic, social, and health consequences of COVID-19 mitigation strategies, such as social distancing. Native Hawaiian and Pacific Islander communities in particular have been disproportionately burdened by the COVID-19 public health crisis. Evidence suggests that Native Hawaiians and Pacific Islanders are 3 times more likely to contract COVID-19 compared to white people, and nearly twice as likely to die from the disease. Asian American, Native Hawaiian, and Pacific Islander people are about as likely to get COVID-19, to be hospitalized as a result, and to die from it than are non-Hispanic white people. In one news report, we know that non-Hawaiian Pacific Islanders, particularly Chuukese, Marshallese, and the Samoan communities, made up about 23% of Hawaii's coronavirus cases, even though they count for just 4% of the total island population. These data had decreased since earlier in the pandemic. At one point, the community comprised about 1/3 of all COVID-19 cases statewide. This is just a bit of what we know regarding the Asian American, Native Hawaiian, and Pacific Islander communities. As a scientist, this is the part that concerns me the most. There remains a lack of disaggregated data about AANHPI populations, which obscures inequities. The lack of data specific to our diverse populations hides some inequities caused by socioeconomics, health, and access. As a result, our communities are unaccounted for and feel invisible. Most of my Pacific Islander family is reluctant and continues to be hesitant to reach out to their own doctors or their medical providers and initiate conversations about the COVID-19 vaccine. Because 1, there are cultural norms of deference that they are adhering to, but 2, they in fact feel invisible. They feel overlooked and, quite frankly, unimportant. And this is why I am here today. This is why we at the Department of Health and Human Services and the Office of the Surgeon General are here today. We are here ensuring that we overcome Asian American, Native Hawaiian, and Pacific Islanders being overlooked. Local doctors will make the difference in how we beat this pandemic. They are on the front lines working directly with patients, and I'm happy that some of them will have the opportunity to share their knowledge and wisdom with you today. Listen to them, and let's all get our family and friends to reach out to their local doctors so that they can learn firsthand how vaccination is a a critical tool that's available to them to help stop this pandemic, because together we can do this. Thank you. Stella, I turn it back over to you.
Thank you so much, Dr. Rosario. And thank you once again to all of our speakers, Tim, Dr. Murthy, and Dr. Rosario, for your welcome remarks. Now we will move into the second part of our program. Media partners, in a few moments, we will virtually move you into the second part of our event with our local doctors. There are 8 breakout rooms, so conversations in English will take place in the following 3 rooms: Filipino, South Asian, and Native Hawaiian and Pacific Islander. Conversations in language will take place in the following separate 5 rooms: Cantonese, Mandarin, Japanese, Korean, and Vietnamese. This means that for those of you joining from your computers or laptops, you will have the option to select which virtual room to join. For those of you who are calling in by phone, unfortunately, you will not have the option to move to the new virtual space without assistance. In which case, please stay on the line and our staff will help you move into the room of your choice. For those with a computer or laptop, here are the instructions. When our team opens the breakout rooms, locate the menu bar on the bottom of your screen and click Breakout Rooms. Next, click Join and you will automatically enter the room. If you don't see it, don't worry. We will help you momentarily. Alternatively, you can click the button Ask for Help. We do ask that all participants be patient, as our team will be supporting each person in this room one at a time. Now we will open up the breakout rooms. Please check your Zoom menu bar and join the room of your choice. Again, we are opening up the Zoom breakout rooms. So please locate at the bottom of your screen the Zoom menu bar where it says Breakout Rooms. Please select that option and then click the room that you wish to join. Click on the word Join and you will be placed in that room momentarily. If you are not sure how to locate it, please click on Ask for Help. And in the meantime, with everybody on the line right now in this main room, we'll be taking a look at the participants list. We'll be joining those rooms shortly. I see that we are still migrating over to those rooms. So I'll take a moment for everybody to take a look at the screen now for directions on how to join the breakout room. If you will just give us one moment, we are going to start assigning folks to their respective rooms, especially if you are unable to join that room on your own. Please give us a few moments. We will be moving our participants over to those rooms right now. Really appreciate your patience, everyone. Again, we are joining our breakout session rooms at this time. If you are unable to see at the bottom of your screen the option to join a breakout session room, please message us in the chat box. If not, we are currently, our staff is moving everybody into their respective rooms at the moment. So please stay on the line. Our team is helping move all of our participants into their respective rooms. Again, for those of you who are joining, we are now going into our second portion of the event. We are moving into our breakout session rooms. I'm going to start off with phone numbers at this time. For those of you who are on the line, Our team is currently moving a lot of our participants over into their respective rooms.
Stella, I'm ready when you are to begin moving, to assist in moving.
Okay, wonderful. We have a phone number here. Let me just double check that phone number. Why don't we go ahead and start?
I'd like to start with name, Stella, if you don't mind. I have Huiyan Chang, if you are here.
Will you be able to unmute this participant so we can help them?
I've allowed unmuting for everybody, so you are able to unmute yourselves.
Okay, let's start off. Actually, I have a list here. I will start with Albert. Albert, could you please let me know which room you would like to move to? And you do have the option to unmute yourself at this time. I think we're having trouble hearing you, Albert. I'm going to move to the next person. So Yi Wang, can you please unmute yourself and let me know which room?
Can you put me into English room, please?
Yes, one moment, please.
Thank you.
I'm sorry, Stella. I got the last name, but I didn't get the first name.
Yi Wang, W-A-N-G.
Which room?
English.
And which English room? We have Filipino, South Asian, and we have Native Hawaiian and Pacific Islander.
Hello, excuse me, I can't hear that.
Yes, we have three options: Filipino, South Asian, and Native Hawaiian and Pacific Islander.
You don't have other options?
We have Cantonese and Mandarin as well.
Well, either English room would be fine for me, actually.
Okay.
Sounds good. Thank you.
No problem.
Okay. Next person on the list, I'll just go ahead and start with alphabetically Angela Hui Chang. Angela, could you please unmute yourself and let us know where you would like to go? Which room?
Whenever they.
Angela, are you able to unmute yourself? Angela, we are unable to hear you. We're going to move to the next person. Angeli Giambra, could you please unmute yourself and let us know
Yes,
which room you
hello.
would like to join? Yes,
South Asian room, please.
thank you so much. I will move you now.
Thank you.
I'm
Next
sorry.
person.
I'm sorry. That name is not showing up. Do you mind repeating that name for me, please, Stella?
Oh, I've already moved them.
Okay, thank you.
Thank you. Next person, Atlanta Huyen Chang. I think that's the same person, Angela. Could you please try to unmute yourself? If not, I'm going to move to Belle Happyland. Belle, are you able to unmute yourself and let us know which room you would like to join? Belle, if you can hear me, could you please unmute yourself? Okay, I'm gonna move to Benson Ho. Benson, could you please let me know which room you would like to join? I'm sorry, you are muted. I'm going to ask you to unmute. Anna, I don't think they're able to unmute themselves, so I'm going to ask them to unmute.
Cantonese for Benson.
Thank you.
Stella, just to confirm, that feature has been turned off, so they are able to unmute themselves.
Okay, thank you.
Stella, this is Kate.
Hi, Kate.
Everyone is asking in the chat, are y'all moving people from the chat? Because the breakout room did not appear for anybody. Nobody had that option. Are y'all able to move people based on their questions in the chat? Because that looks like most people have asked in the chat.
Right,
Yes,
right.
we're
Thank you
going
so
through
much.
it.
Okay, just checking that y'all were doing that.
And Anna,
Yeah.
feel free to open up that chat box and to also help move the folks that have already written that down. For everybody who is able to create a response in the chat, please let us know which room you would like to join. In the meantime, I will continue on with the list. Cynthia, I do see you here. I'm going to place you over in Vietnamese. Thank you. Danny Lee, could you please unmute yourself and let us know which room? Danny, I think I'm having trouble hearing you. So just give us one moment. I'm going to take a look at the chat and just double check here. Jean, I'm moving you. Jeff in Cantonese. Alex in Cantonese as well. Lucy in Mandarin. Thank you so much for your patience, everybody. We're just sorting through the list and confirming who is going into which room at this moment. Still continuing to move some folks over. Appreciate all your patience. Thank you so much for your patience. We are still continuing to move folks over to their rooms. If you're able to unmute yourself, let's go ahead and ask Candace. Could you please unmute yourself and let us know which room?
If there's anyone on this call that can just unmute themselves, if you'd like to just address your name and where you'd like to go, maybe it'd be a little faster.
Hi, this is Even, NHPI, please.
Even NHPI, got it.
Diaz, Filipino.
Diaz, what is your last name?
Diaz, D-I-A-Z.
I'm sorry, what is your first name?
Melissa.
Melissa, thank you.
Hi, this is Cynthia again. Can you put me in any English room is fine?
Yes, I am looking for your list.
Cynthia, I don't see your name on the list. Are you logged in with a phone number by any chance?
I don't think so.
I see her. I can move her. Could we add you to the Filipino or South Asian or
That's
NHPI?
perfectly fine.
Thank you.
Thanks.
Hi, this is Ke Xu. The last name is XU. Can you put me into Mandarin room?
XU, is your first name Stephanie?
No, the first name is KE or April. I forgot which name I use.
I got it. Which room?
Mandarin.
Please feel free to.
Hi, this is
the
Betty Tai.
Okay.
Hi, this is Arvin.
Hi, this is
Betty Tai.
Sorry, I have Arvin.
Yes.
Where would you like to go?
To South Asian.
Hi, this is E. Can you put me to Mandarin, please? An HPI doesn't look like a fit.
Apologies about that. What is your first name?
EE. It's YIYI.
YIYI. Yes. 1 second, please.
Thank you.
Hi, Stella.
And you said Mandarin, correct?
Yes, please.
Thank you.
Yes.
Yes.
Hi, Stella.
Hi, this is Betty Tai.
Yes, we have Betty and Mark, so I'll start with Betty.
Yeah, Betty Tai. Can you put me into Mandarin room?
Sure, Betty. Are you calling in right now? I don't see your name on the list.
Right, I'm calling from phone.
And what is the last 4 digits of your phone number?
7702.
And you would like Mandarin? And the first,
Yes,
I'm sorry, let me just back up. Is it your area code 626 or 770?
626.
Thank you. And you said Mandarin, correct?
Yes.
Thank you.
Thank you.
Mark, hi.
Hi, Stella. Put me into Cantonese, please.
Yes, of course. I see that you're on your iPad
Cell phone.
or cell phone.
Yeah.
Yes. Thank you.
Thanks.
Stella, this is John. John Young. Would you put me in English group?
Yes, absolutely, John. I will send you to the Filipino room.
Oh, Filipino.
Next, please unmute yourself and let us know which room you would like to be in. Let's go ahead and prompt it then. Danny Lee, if you're on the line, can you please unmute yourself and let us know which room? Hi, can we please have everyone who is still in the room here, please feel free to unmute yourself and let us know one at a time which room you would prefer, your full name, starting with your full name.
This is Tracy. Can I get an English room, please?
Tracy, yes, I'm looking for your name on the list and you're not appearing here.
Tracy, last name is D-O.
Tracy Doe, all right, let me just double check. Are you placed in a different room at the moment?
I am in the room with you, I think. I don't know.
Okay, I think you might be calling from a phone then. Could you please let us know your area code?
714.
714. I'm not able to see that at the moment. Did you perhaps join by iPhone?
iPhone, yes.
Okay, and what was the room again, please?
English or Vietnamese, either is fine.
Okay, I will give this a try. I only see one T with an iPhone.
Oh, I think it says T's iPhone. I'm sorry.
Yes, thank you. I'll send you to Vietnamese now. Thank you.
Great, thank you.
Hi, this is Teresa. I was in a Vietnamese room and then they threw me switched somehow into Chinese room. Can you please put me back?
Yes, of course. Apologies for that.
Thank you.
Teresa, Vietnamese. Oh, I see that she is already in the Vietnamese room. You might have to accept the invitation, Teresa.
I was in the Vietnamese room and then somehow they flipped me back to Chinese room.
I see. Could you please give us one moment, please?
Sure, sure.
Thank you. While we help you out, Teresa, apologies for that. I wanted to double check. with other lists. So Anna, could you please help Teresa with her room?
What phone number was that again?
She's currently in the Vietnamese room or queued up in the Vietnamese room, but we just need to, but somehow she ended up in a different room. So would you mind moving her back into the main room and then moving her back into the Vietnamese room?
Sorry, I'm not seeing a Teresa.
Yes, because she's queued up in the Vietnamese room right now, but somehow I think there might have been a tech glitch.
Yep, I'm putting her in Vietnamese.
Thank you. Okay, Francis, you? Could you please let me know which room? If not, Jonathan Doe, could you please let me know which room you would like to join?
English is fine. Thank you, Teresa.
So would it be Filipino, South Asian, or Native Hawaiian and Pacific Islander? Those are the three options for English.
Southeast.
Southeast? Oh, South Asian? Thank you. I see that somebody has joined as KBFD. Could you please let me know which room you would like to join?
Hello.
Yes.
Hello. This is Dong Kim.
Yes. Hello.
Yes. Can I to Korean room?
Yes. Which number are you? Did you call in through your phone, Dong?
Yes.
Could you please let us know the first three numbers of your area code?
415.
Okay, I'm having trouble seeing.
Got it.
Thank you so much, Anna. I still see that Angela, you are in the room. Are you able to unmute yourself? If not, I'm going to move over to the phone numbers.
Hello.
Yes.
Yes, I'm Noriko. I'm from GG Press. Can you put me in Japanese room, please?
Yes, of course. Anna, I'm having trouble seeing Noriko's name. Are you able to locate Noriko?
No, I'm not. Do you have a phone number you're calling in from?
No, I don't. I don't have phone number here. Hold on. I have meeting ID.
Okay. Are you? I'm unable to locate somebody. Well, Noriko, I'm unfortunately unable to locate your number. Or
really?
A name, yes.
You don't see my name either?
Unfortunately not right now, but if you could just hang on the line, we can help you in just a second.
Thank you.
You're welcome. Either Lynn or KBFD, GG New York. Are you able to unmute yourself?
Yes, that's me, GG New York, sorry.
Oh, GG New York. Oh, no, that's okay. And you wanted to be in the Japanese room, correct?
Yes, that's right. Thank you.
I'll send you now. Thank you.
Sorry.
Okay, we have a few folks still on the line. Please feel free to unmute yourself and let us know which room you'd like to join.
Or put in the chat which room you'd like to go to. We're monitoring both.
Yes, that's correct. Feel free to unmute yourself. If not, numbers that start with area code 310, are you able to unmute yourselves and let us know which room you would like to be in? I might just go through the participants here and just unmute you. I'm starting with a phone number, 310, ending in 2351. I've asked you to unmute yourself. Could you please let us know which room you would like to be in? Yes, 310-704-2351. Which room would you like to be in? I see that you've unmuted yourself. Okay, we're going to move on to 858-279-2988. Could you please let me know which room you would like to be in? Anna, are we still getting some folks in the chat who is able to move?
I have not been receiving anything in the chat box I just got one betting.
Okay, I'm just moving some folks over.
I just put them in the Filipino room.
Thank you. We still have a handful of folks right now who have not joined. Are you able to unmute yourself from your cell phones or whichever device you have joined by? We would be open to accepting any person verbally as well as in the chat. I'm going to actually ask everybody to unmute right now, so I will unmute everybody. Feel free to speak through your mic to let us know which room you would like to be in.
Hey Stella, can I listen in Vietnamese room by from my phone?
I believe her number is 310-2351.
Yeah, this is Victoria.
2351. Okay, I see you to the, I'm sorry, Filipino room?
Vietnamese.
Vietnamese, thank you so much. I'm going to continuously ask everyone who's still on the line. I am pressing a button that says ask to unmute. So if you are able to unmute yourselves, please accept. And let us know your name and which room you would like to be in.
Can you hear me now, Teresa?
Oh, yes.
This is Ken. Can you hear me?
My name is not Teresa, but I can hear you. Could you please let me know your name?
Can Win.
Can Win. I do not see an ID for you, but I see a C.
I see on the screen. I can see you on the screen. This is Can Win, Vietnam Daily News in San Jose.
Thank you. I am going to, could you please speak one more time? I just want to double check. Looks like it starts with a C. Are you calling by phone right now, Ken?
No, I use computer.
Okay, great. I am going to assign you to Vietnamese. Let us know if that works or if it doesn't work.
What's that?
I will now try to move you to the Vietnamese room.
That's fine. Thank you.
Thank you.
Hi, this is Teresa, last name Lee. Can you put me into Cantonese room?
Teresa, last name Lee. I'm unable to see you in the main room here.
Okay.
I think you need to join the Cantonese. You're listed in the Cantonese room right now. And you just need to, I think, accept it.
Teresa, are you able to accept on your device?
I think she's calling in from a different device.
Okay, Teresa, what phone number are you joining in from? Teresa, can you hear us? I'm going to unmute you.
All right, oh, I see what it is. Teresa, are you with Bell Happy Land?
I'm not getting a response from most of the people who are still in the room right now, even though
they might have stepped away.
Okay, that's a good reason why. For those of you who are on the line and who are able to unmute yourselves, please let us know which room you would like to be placed in.
Stella, can you move me to the Japanese? I just want to check Dr. Chihara. It's Charmaine.
Oh, Charmaine, hello. Did you join by cell phone by any chance? Because I'm not seeing you in
I'm on I just don't have my picture, but yeah, no, I'm on computer. I just came from the Filipino, but I figured I just want to check Dr. Chihara.
Oh, I see. Okay, yes, let me go under Filipino and move you, Charmaine. I will move you over to Dr. Chihara's room to Japanese. Thank you.
Thank you.
Hi.
Okay.
Stella,
hello.
this
Yes.
is Cassie. Cassie Wen. Can you hear me?
Tracy, yes, I can hear you.
Can you put me in the Mandarin room?
Yes,
Mandarin
Tracy,
room?
yes, Tracy, which phone number did you join by? Or are you
734?
734? I'm unable to see a 734.
I think it says iPhone.
Yeah,
Okay, and thank you. If it's iPhone, I'm going to try to move you. You said the Mandarin room. Thank you so much.
Thank you.
Hello.
Yes, I can hear some folks on the call. Could you please let us know which room you would like to join? Your name or your
Hi.
outlet?
Hello.
Hi, I'm still on the line.
Yes, my name's Megan from Trippin. The phone number is 858-279-2988. Can you move me to the Cantonese school?
Yes, thank you so much. I will move you right now.
I just did, Stella.
Oh, you did. Thank you so much. Okay, we just have very few people now left in this room, but I hear some folks. So if you are still in the room, could you please let us know which room you would like to join? Go ahead and unmute yourselves. Anna, do you see the breakout rooms list right now and the folks who have not joined, who have not accepted?
Yes, we have Francis, Espiritu, Lynn.
It should be in Filipino.
Tina, who, I'm sorry?
Francis?
Francis.
No, I'm sorry. I thought you were telling me who it was. Oh, I see. Francis, you. Is that what you just mentioned?
Francis is still unassigned. So just an update I'd like to provide for you. We have 16 people in the Chinese room, Cantonese, and we have 25 in the Mandarin room.
Okay.
We have 12 people in the Filipino room, 8 people in the Japanese room, 11 participants in the Korean room, 16 participants in the South Asian room, and 11 participants in the Vietnamese room, 16 participants in the AANHPI.
Okay, great. And you're still looking at the breakout rooms, is that right?
Correct. I'm still looking at the breakout rooms. This is live time. Also, we have the chat open. If there's anyone here that'd like to be placed in the room, please type in the chat and we can try to assist you.
Right, because I'm seeing, oh, Cynthia, hi, you joined back again. Did you end up in the wrong room again? Oh, could you unmute yourself?
I'm out from
Yes.
the Filipino room, so this is it, right? Is there anything else that we need to cover or anything, or is there something after this?
Oh no, that would be the end. Yes.
Okay,
So we'll
perfect.
actually send you the recording after this. I know that there was some process on
Yeah.
the front end, so you might have missed some of the information. So we'll send you the link afterwards.
Okay, perfect. It was good seeing you.
It was really good seeing you too. Thanks, Cynthia. Thanks. Bye. Take care. Okay, it looks like we're at the top of the hour of our briefing here. So for those of you who are still on the call in this main room, I know Angela, I still see you here, Albert, Lynn, Anna, Tina. Unfortunately, the event is wrapping up and our local doctors will not be able to speak with you after this time. And unfortunately, I'm unable to hear you as well, so I wasn't able to place you in a room. So feel free, if you can still hear me, to drop from this call. You can hang up from this main session. We will send you a link after this event. So again, for all of our media partners who are still in this room, unfortunately, we were unable to hear you. We were unable to assign a room to you, so we will send you a link to the event afterwards so you can view the main part of the event as well as what the local doctors have shared. Thank you so much for joining us. I know there's still a few folks on the line, so I'll just repeat myself again. I see a lot of our media partners are still in this room. We were unable to assign a room to you. So feel free to just exit or close your main screen. Feel free to leave the meeting now. We will provide a link to the speeches, the opening remarks, as well as our local doctors.
Hey Stella, is it over?
Yes, it is. So feel free to drop from the call. I am going to reconnect with some of our other team members here, but I do still see media who are remaining on the line here. So I just wanted to let them know that the event is over and they are more than welcome to leave the event. So please hang up the phone. Thank you so much.